Hi, we are doing a public announcement, and me, myself, Hong, we have Netta, Kojo, Margarita, and Emmanuel. We are doing about medical marijuana and cancer.
The disease state that we have chosen is cancer. We are choosing cancer because it is affecting many people today, and we want to learn more about how marijuana can help relieve the patient's symptoms. All forms of cancer have symptoms such as nausea, vomiting, depression, and lack of appetite that are commonly affiliated with chemotherapy. Cancer is the disease state in which the cells divide uncontrollably. This is due to the risk factors such as gender, genetic predisposition, environmental carcinogens such as smoke, asbestos, and heavy metals. There are various treatments for cancer, such as surgery, which offers the patients the greatest chance for cure. Radiation, chemotherapy, and neoplastic drugs and supportive therapies, such as marijuana, are also used in these cancer patients.
So in Illinois, marijuana has an approved indication as a supportive therapy for cancer patients to help them with their emesis that is associated with their chemotherapy regimen. Marijuana has shown to have a complex effect on the central nervous system by interacting with the cannabinoid receptor in the brain. This effect decrease emesis and increase appetite. It also decrease pain and also improve the patient's mood. My next colleague will continue.
Thank you, Mr. Kojo. So what I'm going to do now is give you guys a brief synopsis of current literature supporting the use of medicinal marijuana in cancer patients. So in a pilot study back in 2010, Brisbois and colleagues set out to determine if THC would improve taste and smell, leading to an increase in appetite, calories, and quality of life among cancer patients. So what they did was they used adult advanced cancer patients with a decreased sense of taste and smell, as well as appetite, to receive either 2.5 milligrams of Marinol or placebo twice a day for 8 days. The patients then completed a taste and smell survey, a 3-day food record, appetite, and macronutrient preference assessment, a quality of life questionnaire, and an interview before and after receiving the treatment. So the study found that patients who received the Marinol had improved and enhanced taste and smell, whereas the food even tasted better. Furthermore, there was an increase in appetite before eating, as well as an increase in calories from the increased protein intake in patients who did receive the Marinol. Finally, the patients who received the Marinol reported an increase in the quality of sleep. So in conclusion, THC may be efficacious in improving and enhancing taste and smell in cancer patients.
Thank you.
Okay, so although what my friends here are saying is right about Marinol, there are a few things you need to know. First, the dosing. The usual dose is 2.5 twice daily before lunch and dinner. The next thing is precaution. Addiction is the major precaution that people need to know about Marinol. And the next thing we have to talk about is contraindication. The first major one is alcohol because it's likely to cause CNS depression. The second thing is if you're hypersensitive to any Marinol or Dronabinol, it's not good for you to take. The last one is drug-drug interaction. There are few drugs that interact with Marinol, such as metronidazole and most anticholinergic drugs. And drug-drug disease interaction, major one is CNS disease, like neurological disease such as seizure and psychiatric illness such as mania and schizophrenia. Thank you very much.
As you can see, medical marijuana and it's very beneficial in the use for cancer patient because it helps them to increase in their appetite and decreasing other stressful problems. Thank you for listening to us and have